understanding colorectal cancer, screening symptoms, and lifestyle risks on HealthSphere. Welcome back to HealthSphere. Today, we're focusing on colorectal cancer, a cancer that affects the colon or rectum. It's a significant health concern, but one that is often preventable and highly treatable when caught early. Understanding the importance of screening, recognizing potential symptoms, and being aware of lifestyle risk factors are key steps in protecting your health. The importance of screening. Finding cancer. Early colorectal cancer often develops from precancerous growths called polyps in the colon or rectum. Screening tests can detect these polyps before they turn into cancer, allowing for their removal. Screening can also find colorectal cancer at an early stage when treatment is most effective. Several screening methods are available, and the best option for you depends on your individual risk factors and preferences. The most common and comprehensive screening method is colonoscopy. Colonoscopy. This is considered the gold standard for colorectal cancer screening. During a colonoscopy, a doctor uses a long, flexible tube with a camera to examine the entire lining of the rectum and colon. If polyps are found, they can often be removed during the same procedure, preventing them from potentially becoming cancerous. Colonoscopy also allows for biopsies of any suspicious areas. For individuals at average risk, a colonoscopy is typically recommended every 10 years. The preparation for a colonoscopy involves a thorough cleansing of the bowel beforehand. Other screening methods. Stool-based tests. These tests analyze stool samples for signs of cancer, such as hidden blood or altered DNA. These tests are less invasive, but need to be done more frequently. If a stool-based test is positive, a colonoscopy is usually required for follow-up. Flexible sigmoidoscopy. This test examines only the rectum and the lower part of the colon using a shorter, flexible tube. It's typically done more frequently than a colonoscopy and may be combined with a stool test. If abnormalities are found, a colonoscopy is needed. CT colonography. This uses a CT scan to create images of the colon. It requires similar bowel preparation to a colonoscopy, but doesn't involve inserting a scope the entire length of the colon. If potential polyps or abnormalities are found, a standard colonoscopy is necessary. Current guidelines generally recommend that individuals at average risk begin colorectal cancer screening at age 45. However, if you have a personal or family history of colorectal cancer or polyps, or have certain inflammatory bowel diseases, your doctor may recommend starting screening earlier and being screened more often. Recognizing the signs. Symptoms of colorectal cancer. In its early stages, colorectal cancer often has no symptoms. This is why screening is so important. When symptoms do appear, they can vary depending on the size and location of the cancer. It's crucial to pay attention to persistent changes in your bowel habits or other unusual signs and discuss them with your doctor. Potential symptoms of colorectal cancer include a change in bowel habits. This could include diarrhea, constipation, or a change in the consistency of your stool that lasts for more than a few days. Rectal bleeding or blood in the stool. This might appear as bright red blood on toilet paper or in the toilet. Or the stool may look dark brown or black. Blood in the stool should never be ignored. Feeling that your bowel doesn't empty completely. Abdominal pain, cramps, gas, or discomfort that is persistent. Unexplained weight loss, fatigue, or weakness. Narrower than usual stools. Many of these symptoms can be caused by other conditions like hemorrhoids, irritable bowel syndrome, or infections. However, if you experience any of these symptoms, especially if they are new, persistent, or worsening, it's important to see a doctor to determine the cause. Lifestyle risk factors. Taking control. While some risk factors for colorectal cancer, such as age, family history, and genetics cannot be changed, several lifestyle factors can influence your risk. Making healthy choices can significantly reduce your chances of developing this disease. Lifestyle risk factors for colorectal cancer include diet high in red and processed meats. Consuming large amounts of red meats and processed meats is linked to an increased risk. Low in fruits, vegetables, and whole grains. A diet lacking in fiber-rich foods, such as fruits, vegetables, and whole grains, is associated with a higher risk. These foods contain nutrients and fiber that promote good digestive health. Lack of physical activity. Living a sedentary lifestyle increases the risk of colorectal cancer. Regular physical activity can help lower your risk. Obesity and excess body fat. Being overweight or obese is linked to an increased risk in both men and women. Smoking. Smoking tobacco increases the risk of colorectal cancer, as well as many other cancers. Heavy alcohol use. Regular heavy alcohol consumption is associated with an increased risk. Type 2 diabetes. Individuals with type 2 diabetes have a higher risk of developing colorectal cancer, lowering your risk through lifestyle. Making positive changes to these lifestyle factors can help reduce your risk, maintain a healthy weight, achieve and maintain a healthy body weight. Be physically active. Aim for regular physical activity most days of the week. Eat a healthy diet. Focus on a diet rich in fruits, vegetables, whole grains, and lean proteins. Limit red and processed meats. Limit alcohol. If you drink alcohol, do so in moderation. Quit smoking. If you smoke, seek resources and support to quit. Conclusion. Colorectal cancer is a serious disease, but the good news is that it's often preventable through screening and manageable with early detection and treatment. Understanding the various screening options, particularly the comprehensive nature of colonoscopy, being vigilant about potential symptoms, and making conscious choices to adopt a healthy lifestyle are powerful steps you can take to protect yourself. Don't delay discussing screening with your healthcare provider, especially if you are approaching age 45 or have risk factors. Paying attention to your body and reporting any persistent changes promptly is also crucial. By taking proactive steps with screening and lifestyle, we can significantly impact the burden of colorectal cancer. Thank you for joining us on HealthSphere. Stay informed, prioritize your health, and consult with healthcare professionals for personalized medical advice. This video provides general information and is not a substitute for professional medical advice. Always consult with your doctor for diagnosis, treatment, and personalized recommendations regarding your health situation.